Hi, I'm Dr. Lamarche, a nephrologist. Welcome to this video series on advanced chronic kidney disease. This is the third of 6 videos, and we'll talk about in-center and home hemodialysis. We recommend you watch all 6 videos in order. Subtitles are available if you need them. Just click on the symbol at the bottom of the video. This video is also available in French. What is hemodialysis? Hemodialysis uses a machine to filter the blood to remove waste products and excess fluid. Your blood goes from your body, through a needle or a catheter, through tubing, and to the machine. Once at the machine, it goes through a filter, which is like an artificial kidney, and your clean blood is returned back to you. This process is repeated continuously, usually for 4 hours. Now let's talk about the dialysis access. Hemodialysis requires a type of access to remove and return the blood to your body. The veins, which we use for blood tests, are too fragile to be used for dialysis. There are 3 types of access: a central catheter, a fistula, or a graft. We will present each one. The central catheter. The central catheter is also called a central line or a perm cath. It is a small plastic tube, like an intravenous line, that is inserted into a vein in the upper chest area. It is inserted using local freezing, and you don't need to be put to sleep. Here's a picture of a central catheter. The catheter is always covered by a dressing, often a transparent one, like in this picture. Advantages of a central catheter. The main advantage of the central catheter is that it can be used right after it is put in, whereas you need to wait several weeks before a fistula can be used. Also, when it is no longer needed, a catheter can be removed. Here are some possible disadvantages of a central catheter. There is a higher risk of infection with a central catheter than with a fistula or a graft. As the catheter is in close contact with the blood, infection can spread to the blood and to other areas of the body, such as the heart. This is why the catheter must be kept clean and dry. When the catheter gets wet, it increases the risk of infection. That is why you cannot shower or swim with a central catheter. There's also a risk of getting a blood clot near the catheter, but the catheter is filled with a special fluid at the end of each treatment to make this less likely. If the catheter is in place for a long period of time, it can cause damage to the blood vessel. The second type of hemodialysis access is the fistula. A fistula is created by joining a vein and an artery together under the skin, usually in the arm. To create a fistula, a short surgery is needed. This is done by a vascular surgeon. Connecting the artery and the vein allows for more blood to pass through the vein, and the vein gets bigger. The vein becomes stronger and can be used many times. It is also easier to insert the needles needed to do the dialysis. You must wait 6 to 8 weeks after the fistula is created before it can be used for hemodialysis. At each dialysis session, a nurse will insert 2 needles in your arm to do the treatment. The needles will be removed at the end of the treatment. You should avoid having your blood pressure taken or your blood drawn from the arm where you have a fistula or a graft. Here is an example of a fistula. Advantages of a fistula. Fistulas have the lowest risk of infection and are very rarely the cause of severe infections such as blood infections. A fistula preserves your other veins in case you need another type of access in the future. You can shower and swim with a fistula. You do not have any bothersome catheter or a dressing. It is generally the type of access that has the best longevity, meaning that it works for the longest amount of time. Possible disadvantages with a fistula. Sometimes fistulas don't work as expected, or people don't tolerate them well. In that case, we can repeat the surgery or change the type of access. About 1 fistula out of 4 will not work. There is a small risk of a bleed with a fistula. The fistula can be big enough to be noticeable in your arm. It is usually permanent, although a surgery can be done to remove it if absolutely necessary. When you have a fistula, 2 needles are inserted at each dialysis session. The third type of hemodialysis access is the graft. A graft is similar to a fistula. For a graft, a vein and an artery in your arm are connected together under the skin by a small plastic tube. This tube is under your skin and is not visible. From the outside, it looks similar to a fistula. Like a fistula, a graft requires needles to be inserted at each treatment. Possible disadvantages of a graft. Like a fistula, a graft may not work as expected. It requires needles. There is a small risk of a bleed, and the graft is usually permanent. Other disadvantages of a graft compared with a fistula are that the graft has a higher risk of infection, and if the graft gets infected, it can be more complicated. The risk that the graft may stop working increases after about a year and becomes greater than that of a fistula. Eventually, it may need to be replaced. A graft is done when a fistula is not possible. The vascular surgeon decides if a fistula is possible or if a graft is necessary. You should also avoid having your blood pressure taken or your blood drawn from the arm on which you have a graft. We've talked about the 3 types of access with hemodialysis: central catheter, fistula, and graft. Now we will talk about where hemodialysis is done, in a dialysis center or at home. Although it's the same type of dialysis, there are important differences between the two. In-center hemodialysis. In-center hemodialysis is done in a dialysis unit, often at the hospital or in a clinic. With in-center hemodialysis, the nurse will do the treatments for you. You usually sit in a chair and you can do activities such as reading or watching television during the treatment. The dialysis schedule. Treatments usually last 4 hours and are 3 times per week. There is also time needed for setup and recovery. On average, you will spend about 15 hours at the hospital or at the clinic per week. Treatments can be in the mornings, afternoons, or evenings. The dialysis unit will give you a regular schedule with a time and days of the weeks reserved for you. For example, you may have dialysis every Monday, Wednesday, and Friday afternoon. The dialysis unit will determine your schedule based on availability and your preferences. Advantages of in-center hemodialysis. Nurses do the treatment for you. You have days without dialysis, usually 4 per week. There is no medical equipment in your home. Dialysis can be an opportunity to socialize with other people who also do dialysis. Possible disadvantages of in-center hemodialysis. There is less independence than with home dialysis, and the schedule isn't very flexible. There are more restrictions on what and how much you can eat and drink. The amount of fluid you can drink is limited. High blood pressure can be more difficult to control. You may be tired after the treatments. Some people have dizziness, cramps, or nausea during the treatments. Travel for vacation is possible, but it can be more complicated. Now we will talk about home hemodialysis. With home hemodialysis, you have a dialysis machine at home and you do your own treatments. The dialysis schedule is more flexible and you are more independent for treatments. You also have more responsibilities with this type of treatment. The hemodialysis machine and water filtering system are provided to you. The water filtering system has to be installed in your home to ensure the water used for dialysis is very clean. It is best if you have someone with you during your treatments. You can call your healthcare team for support. The hours during which you can contact your care team may vary, so we invite you to inquire with your care team directly. Here are some advantages of home hemodialysis. When you do dialysis at home, you have more independence and you don't need transportation to get to the dialysis unit. With home hemodialysis, you have the flexibility of doing more frequent or longer treatments, for example, during the night. There are many advantages to this, including better blood pressure control with fewer medications, fewer symptoms, and more freedom in what and how much you eat and drink. Here are possible disadvantages with home hemodialysis. You need training. It takes about 1 to 2 months to feel comfortable and independent with the hemodialysis process. The training is done during dialysis sessions at the dialysis unit. You have more responsibilities with this type of dialysis. Home hemodialysis requires time for the treatments, but also for preparation and maintenance of the dialysis equipment. The hemodialysis machine and water filtering systems take up space in your home. It may require some home modifications, such as plumbing. Costs for the home modifications are reimbursed. It is more difficult to travel on vacation than with peritoneal dialysis. Now, take some time to think if hemodialysis, in-center or at home, would be a good choice for you. Write down any questions you have for your healthcare team. Having chronic kidney disease and having to make a decision about your future treatment is not easy. There are support groups in the community that can help you. They are often run by kidney disease patients or their caregivers. Support groups offer information, support, and links to resources that may be helpful to you and your family. You can also visit the Kidney Foundation of Canada's website to connect with their support group. Click on the link in the description of this video at the bottom of the screen for more information. You can also pause this video and copy the link which is shown on the screen. You can also ask your healthcare team about support groups in your community. This is the end of the video on hemodialysis. Next, we will talk about kidney transplant. When you feel ready, click on the link below to start the next video.